were just talking about healthcare jobs as a part of all of the that the Labor Department looks at. And we want to bring it back in. Janet Elkin, CEO and president of the Icahn Medical Network, after the economy added about 6,000 healthcare jobs last month, which does not seem like a high number. And so, Janet, tell us what you are seeing in your business here in terms of being able to get workers on board.
Shortages continue to be really at a critical stage. So the numbers don't really tell, I think, the full story. And of course, we all know about the shortage of nursing. It continues to escalate, but also physicians as well. How many of them are retiring earlier than they would have at a time when we really need them most? They're just completely burnt out. As much as we talk about some surgeries being postponed or elective surgeries or being canceled, but there are more surgeries than ever, I believe, happening now because of pent-up demand. We don't have enough anesthesiologists or CRNAs that are in my independence division. It is just critical across the board. And as the Labor Secretary said, the crisis for mental health is taking its toll because we don't have nearly enough psychiatrists.
And Janet, really the shortage is impacting, of course, many parts of healthcare, but nursing in particular. Are you seeing hospitals begin to tap a pool of international nurses and get them over here to help address these issues?
Well, they are. They're trying to get over here as much as possible. Obviously, there's issues with that too, right? In a pandemic, they're basically trying anything they can. Retired nurses that maybe wouldn't have been considered earlier on to do temporary work, but now are being brought on, even if they're not that experienced, because they just frankly need the help.
And talk to us a little more color about why people, like what exactly is happening? When you say people are burnt out, are people quitting? Is there very little pipeline also of new people coming in? Talk to me about what that departure from the workforce looks like.
Well, it's stunning, actually. You've got a combination of factors. If you look at the fact that the average age of a nurse is 48, and it takes a while. We don't have enough nursing schools. We don't have enough professors. They can't just obviously in a hurry get out there, and then doctors even more so. So there just simply aren't enough. And as much as we talk about the vaccine mandates, there's the other side of that there are physicians and nurses that are just, they're so burnt out by what didn't have to happen for the folks that are in critical care that they're leaving as well, or they want more of a work-life balance because they've just had enough.
Jen, as we learned in today's jobs report, among many things, wages continue to be on a rise. What are some of the compensation packages looking like right now if you're a nurse or work in the space?
I mean, we're seeing sign-on bonuses, the likes of which we've never seen before. And I think finally we're starting to see a difference in terms of understanding that this generation doesn't want the same, no matter what they pay them. It's not just about compensation. They also want to have some real time off. They don't want to have to go from a night to a day shift back and forth because they have families to consider as well.
And Janet, finally, I want to bring up something else I was just talking to the secretary about, and that's vaccination mandates. I'm curious if you guys have a mandate, and are people, even in the medical community, are people resistant to that?
Well, we don't see it very often with physicians. We do occasionally see it with nurses. As a temporary agency, we don't have a mandate, but the hospitals do. So it's getting much more difficult for these folks to find a place to land. I actually have a mandate in my company for my employees, and we're mainly remote because I feel that if you're in healthcare, you should be vaccinated.
Makes sense. Seems to make sense, doesn't it? But unfortunately, not everyone sees it that way. Janet Elkin, great to catch up with you today. Thank you so much for your insight. CEO and president of the Icahn Medical Network.